We're all here for you and your child to listen, provide supports, and walk this journey together. So I'm Jan Marson, Executive Director and founder of Carson City Rural Child Advocacy Center.
First of all, it's important that I'm able to identify correctly which children have experienced trauma or potentials for SAME or at risk for SAME. So that's my job, is to rule out who is in danger.
Not everyone knows of these types of cases. They're difficult to talk about. They don't come up in normal conversation, but I can tell you they happen everywhere. Having this type of center here is exactly what those kids need, to be able to come and recount what's happened to them so that we can seek justice, certainly as a prosecutor, on their behalf.
Well, here at the Child Advocacy Center, our primary concern is child safety. So getting children in a safe environment where they can tell their story, where they can be heard and protected.
When families can come to one center to get their needs met and don't have to go to many different places, it takes the stress off of them. The Child Advocacy Center will provide an advocate who can help families navigate each step of the way, and it can all be done in one place.
As a single location to obtain these initial services is essential. It follows this national best practices. It follows trauma-informed care. So when a child comes here to make those disclosures, it's often very difficult, but then they can have the medical resources available to them. They can have the subsequent counseling necessary for them or any non-offending caregiver that's now taking care of them. All of those things can be found in one place.
In these rural areas, we just don't have the medical coverage. We're not charging these patients. These patients don't get charged. You see a medical doctor for free. You see a nurse for free. You see a social worker for free. So this is, all funded by donations.
We're really lucky because we have this great multidisciplinary team, law enforcement, child protection, mental health, prosecution, all on board here. And they also support each other. It's really important that child-caregiver relationship. This just isn't a kid. These things are happening to families. So we really look how we can support the whole family.
We benefit the community because our children and families are getting connected with immediate resources. There is a much more efficient and streamlined process to help these families heal so they can go on to live fulfilling lives.
Having the courage to come here to tell their story, some of the most scary, frightening types of things, that's what keeps us all going. Thinking about that, keeping them safe, and building on resilience.